Welcome to our channel, ladies and gentlemen. Kenyans are still reeling from the shocking revelations of the shambolic transition of our very sensitive healthcare. Yesterday, some very brave Kenyans stormed a meeting in which Deborah Barasa, who is the CS in the Ministry of Health, was briefing Kenyans on this very matter that we are talking about. And a certain mama there who was actually concerned, she was also a patient, decided that enough is enough. And she was not going to massage things anymore. She decided to expose what is happening.
Please leave me alone for 2 minutes. Let me cry with this mother. And he knows as he was there. And we are outside there waiting the gate. We are at the gate waiting. 20 patients. We have walked all the way from Kenyatta Hospital, coming here for treatment. From last week, Wednesday, the systems are not working. And I have come here to protest, to say that they are not working. There are patients in the ward who have been discharged, and they have not been treated. This man has a child. Come sit here. He has come all the way from Kibwezi. Come and sit here. His child has swollen a coin. From yesterday, he has been waiting for the shot to work. It is not working. We have, ladies, please, if you want, you can come and join us down there. We have patients who are sitting out there waiting for that shot, and it is not working. They are not approving. We have walked all the way to NHIF. We have been told that they are unable to access the portal. We have been in Kenyatta waiting for that portal to open, and it is not opening, it is not working. Please be aware, it is not working. Approved. Now you can imagine I've decided to come and help her. And also me, myself, I'm sick. We also have other patients. There are people who could not walk. We have walked all the way from Kenyatta Hospital. Miguu, mpaka huku. Na tumeteremka huko in hiyo NHIF building. Nothing was done. We were not helped. So when we come here, we are coming here as Kenyans. And we are asking for whoever is approving or whatever is happening. Can you talk the truth? And that is all I'm requesting as a Kenyan. But when you pay, pesa inaingia. I paid, inaingia. Lakini when it comes to approval, hakuna.
Now, after that encounter, many Kenyans gave their views, and they're saying that things are headed in the wrong direction. One of the people who talked about this is the very controversial lawyer, Willis Otieno, who is saying that William Ruto and the UDA government has lost it completely. And I want us to listen to Willis, and then we come back because we want to look at what is ailing the UDA government as far as the healthcare system and program is concerned. As we listen to him, please don't forget to subscribe to our channel. Click the notification bell so that YouTube can notify you whenever we release a video like this. Kindly like our videos, share the videos, and thank you very much for your continued support.
Say this, you know, it's quite disheartening to listen to the Kenya Kwanza choir as they speak, because they try to reduce this conversation to be about numbers. I'm not even saying that Kenyans are not enrolled in SHA. They have. So the question of 17 million or 10 million in NHIF is immaterial. We are saying, even if you've enlisted 40 million Kenyans, what is the quality of care that they are receiving, those who are in? You see, they are so consumed with competition and contests that they think because I have more numbers, now my system is working. We are simply saying, those who are within your system, the 17 million number that you're running around town with, are you giving them quality healthcare services? And when you ask that question, all they tell you is that my driver called me, my friend called me here. Why is that only those who call you, who have access to you, are able to tell good stories about SHA? I'm talking about a majority of Kenyans who are facing and dealing with critical healthcare challenges today and don't need to call the Mheshimiwa here or call Mheshimiwa Ruben to be able to tell a good story. I want that Kenyan who cannot access, my grandmother, who doesn't know how to use a phone, who cannot call anybody to tell how good it was for her, who can only say, if you meet her, that I went to hospital and this was my experience. Shift share was paid. And when you talk about trust deficit in this country, there's nothing about trust deficit. Kenyan people are woke. Kenyan people are learned. What we have that we must accept is mediocrity of leadership. And that mediocrity of leadership is what the Kenyan people are calling out. Because if it was a question of trust deficit, that Kenyans are pessimists, we are just complainers, we are not complainers. We don't create the facts that inform the misadventure of Kenya Kwanza. They create those facts. And when we call them out, they should not say that we are pessimist, we have a trust deficit. We are simply responding to the mediocrity of leadership that this regime is serving the people of Kenya. And then finally, let me say this. When it comes to questions of healthcare, we can pontificate about other things, even education, we can pontificate. Yeah. But this is someone's life. Some of these kidney dialysis patients who are not able to get services. That mother who was yesterday had to walk from Kenyatta Hospital to go and storm the press briefing by the CS Health. It was not because she wanted to create drama. This is somebody who is going through frustrations. These are life and death matter. People have died. He says that we have comprehensive healthcare services. I challenge these members of parliament, these ones here, who are paid by taxpayers' money. These ones who, if they get a cough, they are sent to South Africa for a cold. I want to challenge them to all drop their comprehensive healthcare services that they cover that they have in parliament and all register in SHA and drop the private healthcare services. Because even what accommodates them is paid for by that poor mother who could not get services in Kenyatta. And yet then, if Kiborek here gets a cold, Kiborek will be flown to South Africa tomorrow in the morning. Just for treating a cold. Yet you are that young boy who are being told had swallowed a coin and was not able to get surgical services just right here in Kenyatta. But Kiborek will go to South Africa for a cold. This is conmanship. This is misleading the people of Kenya. You cannot be benefiting from public coffers, and then when you are given a national platform like this to discuss critical issues affecting the people of Kenya, you end up trying to gaslight and to mislead. Right. We have to reject this conmanship.
Okay. So, ladies and gentlemen, we must not live in denial anymore. There is a problem. And you see, if we don't accept that there is a problem, we will not have any solution. You can only strive to get a solution to something which you feel is not working right. But if you continue to believe that things are right, then there is no need for you to look for a solution. So what exactly is ailing the Kenya Kwanza government? For us to understand the problem, I want to start by reading what Deborah herself wrote on her Twitter handle, and it will tell you where the problem is deeply rooted. Deborah briefed us saying, "Today I had the opportunity to update the public on the Ministry of Health's ongoing efforts to ensure affordable, quality healthcare for all Kenyans." And I want you to see the second statement. With 17.8 million people now registered under the Social Health Authority, we are laying a solid foundation for universal health coverage. Underline 17.8 million. And then she continued to say, through initiatives like the National Equipment Service Program, we are enhancing healthcare access and improving the delivery of critical services like kidney transplants, cancer treatment, and maternal care. Underline those very diseases because I want to come back and talk about them. These advancements are crucial in making sure no one is left behind. Let's continue working together to build a healthier, stronger nation. Ladies and gentlemen, the number one thing that is ailing the Kenya Kwanza regime is that they have detached themselves from the real problem. You see, we are talking about, they are talking about apples, we are talking about oranges. We are not reading from the same script. When Kenyans are saying that this thing is not working, they are concerned about the numbers. So to them, they think that the bone of contention is in the numbers that are registered. Well, in real sense, just like Willis was saying, we are not trying to contend that people have registered. As a matter of fact, very many people have registered. They are saying it is 17.8 million. It could even be more than that. And there is no problem with the people who have registered. In fact, it is said that when you register or when you send money, when you pay for the SHA, there is no system that is hanging. Everything is working. But now when you go and you want to get value for your money because you have paid for it, then all of a sudden the system is not working. It is not updated. You go to Kenyatta Hospital, you go to the offices, things are not working. So the bone of contention is not the numbers. The government, the UDA government, is so much engrossed on the numbers. They are so much full of themselves. Anytime you talk, it is about their numbers. Numbers, numbers, numbers. It is the quality of healthcare that they give to the people who have registered. That is what people are talking about. That mother was saying that there's a parent who brought his child because the child had swallowed a coin. And for more than 24 hours, there was no treatment. She had not received treatment. Why? Because the SHA is not working, yet they have paid. Then there is another serious one where a mother had gone through CS, the cesarean delivery, amekatwa, and then she needs to go back to be checked, and this thing is not working. But the government, Deborah, the Ministry of Health, does not see the sensitive nature of it, that the system is not working. All they want to talk about is the numbers that have registered. So that is the problem. They are so much concerned about the numbers that have been registered. Now, number two, apart from the numbers, because it tells you their priorities. As long as people have registered, then do you know what they think? That now people love William Ruto, people love the policies. That is what is in their mind. They want to politicize. Number two, they are insensitive to the problems and predicaments of Kenyans. And why am I saying this? I told you to mark the diseases that Deborah was talking about. She mentioned that they are trying to improve the delivery of critical. She herself is saying critical services like kidney transplants, cancer treatment, maternal care, and I know there are things like dialysis. That's why they are talking about maybe kidney transplant there. And I want to tell you why they are not sensitive to the predicaments of Kenyans. If the system is not working and someone has to go for dialysis, and I understand that the dialysis, maybe people go for, maybe is it weekly or monthly, and then the system is not working, yet this person has paid. Do you think these people are sensitive? And I understand that our members of parliament have got a comprehensive coverage, so they don't depend on the SHA thing that we're talking about. When they are sick, they are flown beyond the borders, South Africa, England, and all that, to be treated. Yet they keep on praising the SHA. So they are not sensitive. And I want you to take, for example, a person who has to go for chemotherapy, a person who's diagnosed with cancer, and the SHA is not working. Yet they keep on giving us briefings, how this thing is working. We've laid a foundation. For how long do you lay a foundation? This thing had been launched. They had laid the foundation. We need to see it working now. You cannot lay a foundation forever. Even if you are building or constructing a house, the foundation is only laid once. Then the takeoff must be proper. The government is not sensitive. They are so much full of themselves. They want to have some political mileage. If they were sensitive, they would not be playing with such critical dockets like health. So like Willis is saying, you can procrastinate on things like maybe education. If you don't give the capitation fee to schools on time, obviously you are interfering with maybe a child's life in future. But this child can even repeat maybe once for 1 year, he will continue. But on health, you delay a service for someone who is suffering from cancer or kidney diseases or something, she will be normal, she will be dead. So the government does not see the sensitivity of the matter. They are playing around with the life of Kenyans. And that is also ailing them. Number three, there are a lot of wrangles in these ministries. Just the other day, the PS in the Ministry of Health and Deborah himself are embroiled in a tug of war, a supremacy battle. Who is the appointing authority? Who has got more powers? And when all this is happening, you realize that they lose their priority. They do not understand what is happening, because they, instead of channeling their efforts to ensuring that policies work, that the SHA works, they will be channeling their energy to the wrong direction. They keep on fighting as to who is superior. And the last one, the government itself. If you look and listen to the people who are allied to William Ruto, you will realize that the whole system has collapsed. Why? Their priority now is not service delivery. Their priority is telling us how William Ruto will be re-elected, by hook or crook, whether we like it or not. To a larger extent, they're even telling us to our face that they can even decide to extend William Ruto's term for 24 years. And when this is happening, you realize that these people have lost touch with us. They're telling us we are the voters who are supposed to be massaged. They're supposed to seduce us. They're supposed to persuade us and try to convince us that William Ruto is the best by action, telling us what he has done. They should tell us that abductions have stopped. They should tell us that SHA is working. They should tell us that the fuel prices are going down, and that's why we need to re-elect Ruto. However, we are in 2025. We've just begun. It's just beginning. Yet these people are thinking about 2027, knowing very well that they have done nothing, and the reality is dawning on them. So what do? They are busy campaigning, telling us that William Ruto must be re-elected, instead of focusing on things like SHA, instead of focusing on what they promised Kenyans, instead of focusing on the university funding model. What do? They are busy campaigning. Not even campaigning, they are busy telling us that William Ruto must be re-elected. So when you see people who are so much concerned about Ruto's re-election at the expense of service delivery, then it tells you that the whole system has collapsed. And this is what is ailing this government. And when those very gallant Kenyans stormed that meeting, it is like the Gen Zs going to the streets, because they feel choked. They feel so much sick and tired of a system that is not working, yet the people who are so concerned keep on issuing statements that are fallacious to hoodwink Kenyans, playing to the gallery for cosmetics. And they told the team, say the truth, this thing is not working. And so, ladies and gentlemen, we are not saying that people have not enrolled. They have enrolled in their millions, but the millions that have enrolled are not getting value for their money. I don't know what you think, but that is my take.